I'll try to cover, and I think it's a good way to begin the, the vendor part of the discussion, a little bit, about the hacker perspective of how, a hacker looks at the healthcare industry, and specifically why hacking can be so easy sometimes, and more than that, how we can do more with existing budget in the cybersecurity space. So my name is Yochai Korem. I'm the Vice President for Sales in Cy. You can see my email address over here. yochai@cysec.com, and feel free to contact me if you want the presentation or to discuss further, and I'll happily share that with you. So maybe those who doesn't know Cy, the company was founded in 2012 by the people who prior to that actually helped to do red team for the Israeli government and the Israeli military, so gained a lot of experience actually how to assess the effectiveness of the security controls you have in place. We're about 70 people today in the company with offices also around Europe, as you can see on the map, which I would say with some of the best national experts in red team that you may be able to find. So our mission statement at the end of the day is to help organizations become more mature in cybersecurity by applying the offensive perspective. And specifically, this means checking whether the existing security measures that they have in place, the people, the technology, the processes, the cybersecurity activities within the organization, are they effective? And for those who are less effective, actually providing a prioritized plan of how to use the existing resources in order to maximize the ROI and to maximize the risk reduction in cybersecurity. So we do that mainly by using our Hiver platform, which is a platform that allows continuous cybersecurity assessment using both technology and experts together. So quite unique combination of people and technology, providing an excellent results, understanding what is the holistic security posture of the organization, and also providing the clear potential attack routes into the organization alongside what is the most cost-effective risk reduction that we can have. So when we go to do an assessment to any organization, right, we want to first understand what is the digital interfaces and what is the potential attack surface we can, and also another hacker potentially can find about the organization. So we do quite thorough reconnaissance stage in that aspect. So from the organization name, and this could be, again, in a specific hospital or a vendor or a manufacturer of any equipment related to the we're trying to actually identify three main things. On the first part, what we're trying to identify what are the IPs, domains, subdomains, etc., that relates to this organization, and from that derive the technology stack that is being used within the organization. And from that, we can actually try to identify where the known vulnerabilities, both in the network or specific applications that are being used, if there are any open administrative interfaces that we can use, etc. And this is all in order to plan potential attack routes. Secondly, we'd like to understand what are the different credentials that we can identify around an organization. And this could be both email, username, and passwords, right? That could be in the darknet, or it could be in the other open sources. But we also want to identify potential credentials and API keys for equipment that is being used. So what does the vendor presents in the manual? So what are the default credentials, etc. And with that, actually, we build a credential dictionary that later helps us to use those in order to try to bypass some of the security controls. And lastly, we try to do an attribution. This means identify the different locations and branches of the organization and verify that we understand very effectively the different attack surface and what actually is related to the organization, even if it doesn't have the same name sometimes. So based on this reconnaissance map, we can actually come and plan an attack, right, in order to see what is effective and how can we potentially bypass the existing measures. So once we have identified those different types of methods, we try to exploit them and actually move into the organization. And again, if we can, this is great because this means that the organization is quite secure. And if we can't, probably also hackers, also are not possible. But if we can, it's better that we'll identify that before others are, do that maliciously. So for example, if we found a login page, we can type, try different types of attacks from SQL injection or user enumeration, based on the information we gathered so far and different algorithms that we have, we'll try to actually go over different attack, chains, so different attack options to get us as closer as possible and bypass the security controls all the way potentially to the inner side of the organization. And I think maybe I can give you through a specific example that will make it, to push some color into that. So a few months ago, we were asked by one of, I would say, quite large healthcare organization, which invests quite a lot in cybersecurity, to verify whether they have an effective cybersecurity processes and organization. And as usual, when we go into an assessment like that, what we want is to define together with the organization what will be the business critical asset. Means what if is going to be compromised, will cause a catastrophic impact on the organization. For this specific activity, we decided to do it in a black box approach. This means we had no prior information about the organization, really coming with zero information, and we wanted to see what we can find out. And we allocated for that for about 4 weeks in order to see what we can do. The 4 business assets that we agreed together with this organization were the following. So we wanted to see whether we can do any compliance violation. As you know, in the healthcare industry, compliance is critical, and violation of compliance can actually cease operation and take down devices that are being used. So this is definitely something that has a big impact. A brand reputation, people need to feel safe when they use this organization and the equipment there, and if they feel that this is not a situation, they will not come, and this is of course a very dangerous situation. Of course, patient data and privacy and the integrity of the information is also critical in order to verify that you can continue the right work in their organization. And lastly was to see whether we can have any downtime of critical systems that will take down this organization. So with those targets in hand, we actually started to do the assessment, and we had different options to get in, but in this case we actually went inside the organization to be like a pretended patient, right? And we found that in the patient waiting area, there are actually some ports that are on the wall that actually allowed us to connect to them. And so we connected and using some passive sniffing, so just listening to the network traffic that is seen from that specific port in the wall, we're able to collect quite a lot of information. And one specific valuable information was a password that was used for a web proxy, and there was no encryption in this communication and this traffic. This is why it allowed us actually to find this information. So with this access to the web proxy, we're actually able to start, escalating our privileges and actually moving around laterally in order to get access to additional computers, additional servers, and compromise additional users. And what you can see in front of you now is actually different assets that we already, as a hacker, had in hand. Just starting from this port in the wall. So we're able to compromise quite a lot of systems, computers, and users that were had different credentials, capabilities. Using this, we actually came into a very interesting application, which was a portal for clients, where all information about the client could be downloaded and actually even modified. So we were able to get access to this patient data portal actually as administrators. So it allowed us actually, for example, to delete all the information from that, or to modify, to put different drugs, for example, that someone could go and buy with a subscription. And you can just I guess imagine yourself what type of damage one can do when they have an administrative access into the patient data portal. But this, for us, just to verify that we achieve all different goals in the assessment, we wanted to go further. And let's say the goal was to be able to compromise a medical device. The medical device that we decided to try to take, it was, in this case, was an MRI machine. So the MRI machine is a very complex computer systems, and they were using an underlying Linux environment. And again, based on some I would say not very complicated attack techniques, we're able to get what we call root access. So we have the most powerful user in this device. So we actually could control and do whatever we want with the device. Of course, we can take it down, but we wanted to see whether we can find a scenario which is even more dangerous than shutting down a critical MRI machine within a hospital. And what we were able to do actually is to change the tables within the device, which decides how much radiation needs to be put in place according to the weight of the patients and the age. So as you're probably aware, not every person has the same amount of radiation. It really depends on the characteristics of the physical body. And we were able to demonstrate that we can put 10 times more radiation than was planned. And this, of course, this would have been causing a catastrophic damage and killing life at the end of the day. So this is an example of an assessment that we have done. And of course, with that, we are planning going further and doing some more activities. So before going to what can we do with this information, let's see what are some considerations in the healthcare industry. First of all, it's clearly that when you're
sorry to interrupt. I hope you can hear me.
Yeah.
We need. I think we have 2 minutes before you can conclude. Okay, so try to keep on time.
Perfect, no problem. So at the end of the day, healthcare has, sometimes different characteristics to other environments or to regular enterprise. And this includes, as I think as discussed before, the patient, doctor, the cloud, the Internet of medical things that, is being put in place. And the fact that you need to have zero downtime and, just, have the business moving very clearly going forward. And this information is something that, of course, we take into consideration where we are looking at specific organizations. As is time in short, I want to talk about two last things. First of all, when we do an assessment, the goal is not to break in, right? The goal is actually to identify what is the security posture and what we can do with that. So in assessment, usually we define what are the threat sources that we want to go after. And as discussed already, what will be the critical assets that we can use in order to go further. And then what we're doing during the assessment, we're trying to map different ways in order to go into the different business critical assets. So at the end of an assessment that can take a few days to a few weeks, we can actually find those multiple areas, those multiple problems help us generate what we call an attack route, a combination of issues together that actually allowed us to get into the business critical assets. And for many, this is the first time they see the entire security posture in one single view, which is very helpful to make business decisions based on data or where they have actually issues that they need, the organization needs to solve. Now, more than that, each of those edges in the graph actually has some metadata, which is helping us to do some more calculations. For example, for each of those edges, we can say how probable is that another normal hacker will be able to do the same as we've done. So for example, 92% would be something that most hackers can do, whether there are some areas that only very experienced hacker can do. With this information, we can actually come up and tell the organization what we believe will be the most probable attack route into the organization. So this is where we believe that the organization should put the highest focus in order to reduce the risk. And in order to cut a route, in order to take away an existing attack route into the organization, actually one of the edges needs to be cut. And based on information like budget available, resources, and duration, and other business impacts, we can actually take into consideration and come up with a specific recommendation to the organization. What are the specific areas that, if they fixed, will be the lowest in budget requirements and with the highest value in risk reduction. And when the organization fixes this, for example, then we're going further. Now we have the second most probable attack route. So this is actually an iterative process in which we are trying to find those things that if they are fixed, they will help the organization disconnect all the different graphs, all the different routes in the graph, and by that improve the security in a very critical way. Maybe towards finishing, I would say that we are not only trying to give the organization how they are comparing to themselves, but also how the organization actually is measured according to other industry organizations or similar peers in the industry in different areas in cybersecurity. So this helps the organization go towards, I would say, a more strategic discussion where the investment should be done in order to reduce the risk. Lastly, we are also helping organizations in additional topics, so from strategic cyber programs in the healthcare industry, helping improve efficiency of security operations centers, different types of trainings, and maybe very critical, especially these days, is incident response, when we have a 24/7 team that helps organization overcome different issues if, you know, once attack is actually happening. And it's critical to have good people with you when you're, let's say, where you're under attack. Maybe last point before I hand over back to Ami, because of this very critical change in the IT environment today, where the remote working or working from home, you know, the IT landscape changes and the attack surface is changing. So what we have actually created is a focused 2-week activity, allowing organizations to validate different areas from the VPN configuration, you know, hardening of the endpoints, as the endpoint now is in a home environment rather than the regular environment in the corporate, etc. Some phishing simulations and others. So very specific 2 weeks activity that, once done, can provide a very clear recommendations how to, you know, continue working from, you know, from remote while keeping safe and not opening, you know, potential doors to hackers to go in. So with that, I will finish. Again, my email address is over here if you you want to approach me directly, and thank you very much for the opportunity to appear in front of you today.